Hi everyone, this is the welcome video to HCI 201, Issues in Healthcare. I'm Brad Rebecker, I'm the director of the Wilson Institute for Medicine. I'm not the instructor for this course, that's Robin Laditka. She's one of our advisors in the Wilson Institute. I'm actually on sabbatical this semester, so Robin is teaching the course. But as you may have guessed from me being here, I'm going to do a lot of work in the course as well and help you all kind of go through it and organize the speakers and just to help make sure that everything runs smoothly and you all get the learning experience that we want for you all in this course. So you'll hear from me a little bit, like on the kind of content side, and Robin will be the one that'll help you all with more of the course management stuff, all the Moodle things, whatever changes come up on Moodle, grade issues, attendance issues, that kind of stuff, Robin will deal with. So if you have questions, the syllabus is posted on the Moodle site and you can email Robin. You can always email me too if you do have questions. So I'm going to use this video just to talk with y'all a little bit about what this course is like and how it's going to function. So overall, why this course exists is to help y'all move from undergrads to health professionals, right? And what we found over the years is that students kind of need help. You're so ingrained in your majors and your minors and your different experiences that oftentimes you don't get the full picture of what's happening in the medical world. And so that's really what we're here to do, is help gain factual knowledge about current events, current issues in healthcare. We want you to be able to start to see things as health professionals see them, right? And think about them not as a college student, but more so like as how do health professionals experience these issues? And the reflections that we'll be talking about here in a second are really there to help you kind of start to see, how does your perspective, how does your experiences and your courses fit into these issues, right? Like, what do you bring to the table already with some of these big issues in healthcare? So the pictures I have there are about this kind of like health and all policies issues. So one of our speakers will be talking on this this semester about how can we, from a policy standpoint, encourage healthy living and healthy activities in all of our legislative efforts in the United States. And then you can obviously see what the second picture is there. We're going to be talking, of course, a lot about COVID and vaccines, and we're going to try to do it from different perspectives. I want you to hear different voices, different experience levels, folks that are working at the vaccine level perhaps, and some folks that are working at the community level, and so we get a good full picture of the pandemic. So that's a good transition to what we are talking about. So I'll post a schedule, a weekly schedule on the Moodle site. I'm keeping the schedule off of there for now because this is a current issues type class. And so as issues arise, I want the flexibility to like change the schedule. So whatever schedule I have up there is like super tentative right now anyways. I have maybe 8 speakers that I know for sure I'm going to introduce you to, but I'm holding some spots in case things change. And when things do change, I want to be able to have y'all experience them and talk about them. So again, some of the things we're going to be talking about, certainly COVID, that's our pandemic that dominates our lives. We're going to cover a variety of different topics within the pandemic and from different health professionals. We'll be talking about some kind of broader public health themes also. So the one speaker I know for sure I'm going to have an interaction with is an alumni, a recent graduate, so a younger person like yourselves that has done work looking at firearm deaths in public health. That's the chart there that I have on the right-hand side. And so Matt will be here to talk with us about that topic, which I think will be really great. We also want to talk about health insurance. Health insurance is often the topic that gets a lot of confusion from students because unless you've experienced health problems yourself, you probably haven't had to access insurance that often. So we'll talk about how insurance works and just some basic terminology and lingo. I have pictures of Medicare and Medicaid. We'll talk about the differences there. And we'll talk about some of the socialized medical programs that exist in the United States. Yes, the United States has socialized medicine, contrary to what you've heard. They also have private medicine as well, private insurance. So we'll talk about those programs in the United States and maybe do a little compare and contrast with other systems as well down the road. Okay, so the structure of the course will look like this. So each week there'll be 1 to 2 topics posted. And I'm thinking of this course, since we're in this module schedule, normally this course is once a week, but we're in the module schedule, so we'll have 2 meetings per week. So kind of think of it as a Tuesday, Thursday class. This first week, it's a kind of a half of a week, so we're only gonna have 1 topic. So there'll be about 2 topics posted per week, and each topic will contain at least 1 video, like 1 lengthy video, maybe 2 smaller videos, and sometimes a short article or news link for you to add to your knowledge base. Overall, there'll be 12 topics for you to consume over this module, and for each topic, you have to write a journal report, which is a reflection. All right, and this is the important part of our topic here. So what you're turning in, how you get a grade for this class, is after each topic, you will write a 1-page reflection. All right, now, before I say what a reflection is, I'm going to say what a reflection isn't. A reflection isn't, it is not a summary. You are not there to summarize what we have just told you. What we want you to do is to reflect on it and think about it. All right, so these graphics here are talking about what it means to reflect, right? Like, so what happened? How does this influence you, right? How does this situation, this healthcare situation, COVID, firearms, some of the other things we're going to be doing revolving health policy or insurance, you certainly will have an opinion and likely an experience that relates to these topics. So we want you to think about that, and then think about how those topics might influence you as a healthcare professional, whether you're going to be an occupational therapist or a nurse or a physician or a dentist, whatever it may be, right? You're going to encounter these things either in your professional capacity and certainly in your capacity as a private citizen, as all of these things are going to be affecting all of us. So your reflection should really be that, right? What is this topic about? Why is it important? Right? And how do your experiences, your values, your attitudes, your beliefs, how does that engage with this topic? All right. So really this is about you and thinking about how these things influence you. You're going to be working on these topics and submitting them then 1 week later. So we'll have a topic for this week's class with Dr. Emmanuel. You'll engage with that video, and then you'll write a reflection that you'll be submitting, and it'll be due 1 week later. You must submit them on the course Moodle site, and please submit them as a PDF as well, not any Word or not any weird pages or some shit that like nobody has access to in their computers. Just make it a PDF and make it easy for everybody. And again, they're due 1 week later. Please don't get behind. You don't want to be that person that's got to submit 5 reflections their last week during finals week. That makes this course suck. So please stay on top of this as we go. All right, I think that's it from me. So again, make sure you stay up on top of the material, write your reflections, turn them in, and everything will be good. If you have questions, let me know. Thanks.